Since we're talking about this on the podcast, let's look at this from a medical kidnapping perspective. Most begin in the emergency room because emergency room doctors and staff are trained to look for and fix immediate needs. Makes sense. That's why it's called emergency services. When they can't really see anything that fits that emergency type box, when something doesn't make sense, or maybe they just don't really understand what's going on, bad things can happen. Unfortunately, a lot of times that bad thing is the assumption that some kind of abuse is happening. Once an abuse or neglect accusation is made, state social services are brought in, and for better or worse, in most cases, they rely on the word of the reporting provider and take the child into immediate emergency custody. With the interpretation power provided to them by the federal agency and the Cheveron Deference, social services can defend these actions with an interpretation of abuse or neglect to fit any necessary narrative. We see this a lot with chronic illness patients. Many providers and social service workers are not trained in chronic illness or how it can present in an emergency room or even at a doctor's office. I will tell you, sometimes it does look like abuse, but it's our own body abusing us. I have been pulled aside multiple times to ask if my home is a safe environment. Yes, it is. What's not safe is what my own body is doing to me. In fact, if it wasn't for the things that the people in my home are doing, Lord only knows where I'd be. If social services, doctors, and even judges don't want to take the time to learn about underlying causes and chronic illnesses, or they just don't understand what's going on, bad things happen. Like when Maya Kwilinski was taken from her family and abused for 89 days because they didn't understand her chronic illness. Or the Hernandez family, who is right now fighting false accusations and for medical care for their infant. So let's look closely right here. The